One part of having Kallmann syndrome is the fact that it is a very rare condition, and the majority of patients who have Kallmann syndrome or CAH have never met anybody else with the condition, or even talked to somebody with the condition, and this can be quite difficult for some patients. Now, part of the job, or part of something I enjoy doing, is talking to other patients. And I spend a lot of my free time either online, talking to people through Facebook groups or media groups, or even on the internet or Skype, or even meeting people in person, because I like the interaction with other patients. And I think this is the only way that, as a group of patients, we can help each other and hopefully gain more information on the condition. A lot of doctors we talk to do not know much about Kallmann syndrome, and sometimes we can talk to a doctor who will say we're the only patient he's ever had with Kallmann syndrome, or he's only ever had one or two cases in his whole career, which sometimes doesn't mean we always get the best advice from our doctors. So being able to talk to a group of fellow patients who also have access to Kallmann syndrome experts, any advances in diagnosis or treatments can then be passed on to the patients, who can then pass them on to their own doctors. And also with Kallmann syndrome, because it's such a personal condition with the lack of puberty, lack of development, it's quite a difficult condition to talk about, because even to your friends, family, parents, because sometimes, however much they want to know about the condition, it's very difficult for anybody else, if not impossible, for anybody else to know what it's like to have the condition. So to be able to talk to a fellow patient without actually having to explain the condition can be very useful. So in our Facebook groups, we have about 200 members in each group. It's probably a small number, but every one of them with Kallmann syndrome, I think, appreciates the chance to be able to talk to other patients. They may only talk once or twice a month, or may only pop in or once a year, but just to know that there are other patients out there with the condition can be very helpful. And we set patient meetings in the United Kingdom and sometimes in the USA as well, which hopefully patients find very useful. It is certainly something I find very helpful. I do spend a lot of time online talking to patients, and I quite enjoy the interaction of being able to hopefully help patients, especially when you meet a patient for the first time. There's so many questions they want to ask, because either they've not had the time to ask their own doctors, and there's quite a lot of questions that really only fellow patients can answer, because they're a very personal condition. When you start talking about fertility treatments, relationships, really only fellow patients can help. So I think the actual interaction with other patients really helps with this condition, and I do appreciate the chance for myself to talk to patients from around the world, and I do enjoy meeting other patients.